Medical Dilemma.
Hi everyone, welcome back. You're still watching Medical Dilemma. I'm Atty. Sara Suguitan. This is Dr. Atty. Teresita R. Sanchez, Father Jerry Manlangit, and Dr. Sally R. Gatchalian joining us in this episode to talk about vaccines. Okay, Doctor, I have a question regarding vaccines. No? What if you have incomplete vaccination? Is that a threat to life, or is that something we should be alarmed about?
If you have incomplete vaccination, there's what we call a catch-up. So, for example, you've had 2 doses before, and dapat 3 doses yung vaccine, then you can be given the 3 dose. There is no need to restart the entire series.
Okay,
So we can
that's
just
good
give you
to
the
hear.
3rd dose or the 2nd dose, whichever you missed.
Yes, that's
nice.
good to hear, especially if, for example, you have growing up kids and then uso yung mumps, for example, or
Yes.
measles, then you...
Mabay ka na sa mga anak mo.
Ayan, so may ka na
Vaccinate.
magpa-vaccine ka na rin. Because that's the whole point of getting vaccines, to prevent the
Yes,
disease
to
once...
prevent.
Yes,
Precisely why it's prophylactic, diba? To prevent.
So if you're exposed to it and you know that you haven't completed the vaccine, then as you said, you can always avail of, the patient can always avail of that catch-up
Yes.
vaccine. So,
Doctor, are
yes,
there
Father.
some ill effects of vaccines if you have so many of them? Or something
In
like
other
are
words,
there
they might
data
cross.
or whatever?
Yeah.
No, Father, because like I said earlier, the vaccines are now purer, so they're less protein, so less reactogenic, less reactions. I mean, the side effects are less now. And for kids, for example, for infants, they can actually tolerate the antigens that you administer. Kasi antigen yung tawag doon. So, kunyari, if you give a 6-in-1 injection, which includes diphtheria, tetanus, pertussis, the Hib, the polio, and the hepatitis B, the infant can actually tolerate. It does not overwhelm the immune system.
Oh,
Kaya safe na safe.
Yes.
Oh.
So there's,
That's good.
Doctor, but when you administer for example, the 5-in-1, is there a downtime for the infant or the kid who is receiving the ano? Ibig sabihin, like for flu shot, ako yung experience ko yung parang dilalagnat ako medyo, ganun.
there's,
So,
there's
safe.
such a thing as a side effect or an adverse effect associated with the vaccine. Generally, you have fever. Usually, it's mild, 2 to 3 days. It will resolve spontaneously, and you can just administer your antipyretic. But it will resolve. For example, the measles vaccine and the varicella vaccine, or your MMR, kasi may measles component siya. Generally, we expect reactions 1 week to 3 weeks after vaccination, and this is due to the vaccine virus. They can have fever, they can have rashes as well, but they generally resolve within 2 to 3 days.
And Doctora, just in case there's fever, what would you advise their patients? Would you rather they be absent from school, for example?
If for example, they're not feeling well, then maybe it's better if the child stays at home. But if they're okay, and if the fever is not that high, then maybe they can go to school. Kasi hindi naman nakakahawa sila.
I see. That's
Yes.
good.
So there are effects of vaccine. This is because of the vaccine virus. But if you explain to the parents what they expect after the vaccination, then it's easier for them kasi they would understand and they would call you. I know you told me about this, but is this the one? They just want to make sure. So
Yeah,
hindi
tama.
sila masyadong worried. They don't get that panicky because you've explained to them that such a case can actually happen. That's why I think we encourage all doctors, anybody who's vaccinating, to explain to the patients, to the parents, what they would expect after vaccination.
Is there anything that the patient should avoid doing, like no exercises, for example, food, ganyan,
No.
after receiving a vaccine? Okay.
Wala naman. There is no such contraindication. In
Dali-dali pala.
fact, colds, cough without fever is not a contraindication to vaccination. It's only a fever of 38 na meron. I-defer mo lang and make sure that the patient is na wala ng fever for about 24 to 48 hours. Then you can administer the vaccine soon after.
how about if the baby or the child is malnourished? Can you still administer?
Lalo na, Father, because they're the ones who are at risk for increased morbidity and mortality.
And
Yes.
it's not going to overwhelm them?
No,
Okay, that's
it
good.
will
It's
not
that safe,
overwhelm them. Kasi mas importante kasi sila yung mas prone to diseases eh.
Yeah. You know, I think the only vaccine I know that's anti-cancer is the one in OB, in obstetrics. We usually give it, supposed to be anti-cancer for cervix.
Ah,
for the
cervical
cervix,
cancer.
cervical cancer.
That's the HPV vaccine or the human papillomavirus vaccine. Actually, the
Yes,
first anti-cancer vaccine,
meron ba
as
iba?
they call, is the hepatitis B vaccine.
Yeah. But I mean for the hepatitis
HPV.
infection, this is
Yeah.
cancer of the cervix.
Yes.
And they give it as young as 9 years old, right?
Yes, ma'am. They give it as young as 9 years. That's an indication. And
Is it a
studies have
permanent
shown that
immunity?
the vaccine actually has the highest antibody response. They develop the antibodies immunity highest in the adolescent, in that adolescent age group.
So
And of course, to maximize the efficacy of the vaccine and effectivity of the vaccine, you administer it, kaya nga prophylactic you administer it before the child gets exposed to the virus.
I see. Because,
Oh,
yeah.
I don't know, Doctora. I still remember this controversy that happened probably more than 10 years ago about those mothers who took the vaccine when they are pregnant.
Which vaccine, Father?
Is it a
The
vaccine or
rubella vaccine?
just an
Or
analgesic or what?
Something like that.
You mean the controversy here in the
Yes,
Philippines
that's
before
right, that's right.
that it causes abortion
Right,
daw?
oh,
Okay, I remember. They were
yeah,
yung
because
HCG na may laman daw, like
Yeah,
the
that's right.
tetanus
Uh-huh,
vaccine.
that's right,
They were claiming, but it's not true, Father.
It's not true,
Yes.
Because actually there were those who had miscarriage, you know already, even if there are only 2 or 3, something like that, and thinking, because when I took that vaccine, the miscarriage came
Happened.
afterwards. So thinking that probably there is a relation between the miscarriage
And the vaccine, yes. But studies have shown that the tetanus vaccine, kasi that's the tetanus vaccine among pregnant women, di ba, Father? Because we have very high incidence of neonatal tetanus. That's why mothers, when they're given the vaccine during pregnancy, can actually transmit their antibodies to the baby to prevent neonatal tetanus. So, what happened was, it was probably just a temporal association. Kasi, ang nangyari, binigay yung bakuna, tapos bigla siya, actually, kaya binigay mo yung bakuna in head, she probably would have had that spontaneous miscarriage.
Well, at least it's clear now, something like that now.
Yes.
There's nothing to be afraid about because there is no association between
Wala,
the two.
Father. And
yeah.
that vaccine can actually prevent neonatal tetanus. That's why we encourage mothers to have their tetanus vaccination during pregnancy.
So,
Kasi they pass
That's
on the
danger with
antibodies.
self-diagnosis, di ba, no, Doktora? Well, a lot of us, don't want to consult a professional because, kaya kong gamutin yan. Same thing with dengue. You were talking to us about earlier na we'd rather come to a conclusion by ourselves
Yes.
rather than actually submit ourselves to a check-up. So,
For example, one example, the child had vaccination. Nadulas, naumpog ang ulo, sasabihin dahil na bakuna. Syempre, hindi naman, di ba?
Cause and
So,
effect.
you're nagkakaroon ng temporal association. But it's not a causal relationship na dahil doon sa bakuna, nadulas siya. Ano naman ang relasyon ng bakuna sa pagkadulas niya, So,
that sometimes come up because people will have their own speculation, etc., because of this and because of that, no? Because probably if he was not administered with this vaccine, he would not have
Survive, maybe.
survived something,
Or
something like that.
In the olden times, there is anti-vaccines, that create scars.
that's
ba
the
yun?
BCG.
BCG.
That's the one that prevents the extrapulmonary complications of TB. The BCG is given at birth. That's the one that causes
now, they do
that can cause a scar.
Also, do you have to put it somewhere hidden? Because baka maging Miss Philippines yan. And then magkaroon ng...
But generally, the recommendation is really to put it in the arm. But sometimes some put it in the buttocks. The BCG vaccine will prevent extrapulmonary complications of TB, but it will not prevent pulmonary TB. But if you get, kasi ang nangyari, Father, if you have pulmonary TB in children, particularly those less than 5 years of age, they get infected because of an adult who has TB. Pag wala silang BCG, yung TB nila pwedeng kumalat sa brain to cause TB meningitis. It can go to the liver to cause TB of the liver or to other parts of the body. But if you were given or administered the BCG, hanggang sa may lungs na lang yon. It will prevent the extrapulmonary dissemination.
Oh,
And,
so you can give it even if there is a primary complex or TB ng bata. You can still give
we
it.
actually give it at birth. The recommendation is to give it at birth. We no
Kung
longer
hindi.
recommend it to be given after.
No more.
Oo.
Why? Because you presume
So,
that they
at
have
birth.
it
Kasi
already.
usually by that time po, may mga exposures na yan.
And that creates some form of immunity. Is that correct?
Well,
or
if,
mabuting
if for
bigyan na
example
rin.
you want to give a BCG, you have to do a tuberculin skin test to see if the
Yeah.
child has an infection or not.
Correct.
Because a positive PPD, yung tuberculin skin test, does not mean disease agad. It's just an infection that the child was exposed and then developed some kind of antibodies, some kind of reaction to the bacteria, to the mycobacterium.
Ang dami, no?
That's a good question. Some people who get vaccines, doctor, you get scars. So is that a product of the the physician or the patient?
Hindi.
Or,
It's
it's
a
innate.
reaction that you
Ah,
expect.
reaction.
Dapat
Yeah.
ganon. Kasi
Dapat
kung hindi,
magkaroon ng
ibig sabihin,
scar.
the
Hindi
vaccine did not take. So it is
okay.
the expected reaction. So when you
I see.
administer the BCG, you know that in 2 to 3 weeks, bubukol yun, parang may laman, and then puputok siya. But when it does, wala naman, you don't have to put anything.
Imagine, ang tagal na
So
noon.
yun ang normal
and
course.
Up to now, they cannot prevent the scar.
But you see,
But that's how it
I
works
could see
talaga.
something, legal complications there. For example, in America, which is a very litigious country. Okay? Well, supposed to be, she might have been a good candidate for Miss Universe for like that. No, as she had said.
Vanity.
And then afterwards, she had that, and she can just be prevented from what you call this, from joining such a, and you can be charged in court.
Oh, Father.
Why can you be charged for that? That's the expected reaction of the vaccine.
That's right. That's why they said that probably she should have put it in my
Ah,
bottle, something
okay,
like
okay.
that. You know, if it is very litigious. As a matter of fact, I
Yeah.
saw it. I think that was in LA when that lady was scalded because of the coffee that
Yeah.
that she
McDonald's
bought
ata.
afterwards, and she could not anymore wear
Shorts.
a bikini. She cannot anymore go to the beach. You know what? The store was made to pay
Really?
for millions. Yes.
Wow.
God.
You know how those things are. That's why there's some legal complications. That litigious country. But in the Philippines, I don't think that's going to happen. I don't know.
At saka in the States, Father, kasi more or less wala na silang TB. And most of the tuberculosis cases that they have are actually exported. You know, coming from like the Philippines
Wow, that's
and
great.
other Latina countries.
Are there no new strains of TB? Because
No,
they
wala,
said-
Father. There's only one.
Oh.
It's the
Because they say
mycobacterium.
that they have become
Ay,
even
Father,
more virulent.
no, for TB, there's just the mycobacterium tuberculosis. But there are atypical mycobacteria na tinatawag. Pero iba naman yun. So, it's a family of the organism, mycobacterium. Pero hindi siya yung mycobacterium TB. Ito kasi mycobacterium tuberculosis talaga.
Dr. Tess, since you're an OB-GYN, do you recommend that all women should get the anti-cancer vaccine?
Yeah, it's supposed to protect them against 4 strains, no? But personally, I don't know. I don't believe in it. But it does
It's
help.
optional,
It's
kumbaga,
supposed-
unlike
it's
for
optional.
infants
You have
na-
to tell the patients, and then it's up to them if they want to get it at any time. Even adults, right? They can get it to protect against cancer of the cervix. Kasi may mga families where it has a very strong history of cancer.
Yes.
And so it can appear anywhere, in any form. So you might as well have it. No
Well,
harm.
actually, the vaccine is supposed to be effective against it's the type 16 and 18,
Yeah,
HPV 16
yeah.
and 18 that causes the cancer, actually. And the vaccines that are available, there are actually 2 vaccines that are available, and they provide almost 100% protection against these 2 types. Now, regardless of the type, kasi there are other tinatawag nila oncogenic types that can cause cancer, the protection is something like 93%.
So, well, if you can afford it, well, it's no harm, right?
Actually, the prices have gone down
Uh-huh.
significantly, gone down. So,
Kasi yung mga vaccines ba yan, do they have an expiration date?
yes, they
They
do.
have, so you can give it only within that
Yes,
time
if
frame.
the vaccine says it expires on June 30, then you can administer the vaccine up to June 30, but not after.
Doctor, when it comes to administering the vaccine, should we only prefer doctors to inject us, so to speak, or is it okay?
Hindi naman, if like you have a nurse, some doctors have nurses in their clinics, And if it's under the supervision of the doctor, then that's fine. You can have the nurse inject. Even in the health centers, there's doctors, and usually the nurses or the midwives are the ones injecting. So they're safe
There's
also.
nothing to worry
Yeah.
about.
Nothing to worry
Okay.
about.
The law allows them to do that.
Yes.
Okay.
Doctor, there is still another issue here, which is a little bit of legal and moral, especially, for example, the patenting of vaccines. Remember that vaccine is also very good medicine for that matter, no? Prevents diseases, etc. And then, you know, when you are a producer or the ones who created the vaccine, no other pharmacies can duplicate that because of the fact that the money that you put into the research and the development of etc., you cannot just copy
Give it
that
free.
for that matter. The copyright, etc., etc., etc. Are there,
It is allowed,
for example,
you know?
the dengue.
Oo.
There
Epidemic.
are other pharmaceutical companies, Father, vaccine companies that are actually trying to develop a dengue vaccine as well.
That's right. But, well, there are medicines that you can copy, actually. But after the prescriptive period, that well, probably they had already recouped their investment, etc.
Yes.
So they can do that. But for vaccine, for example, which is very
Life-saving.
important, life-saving for that matter, and it's going to, well, say, as you have said, save a lot of money, save a lot of life for children. You see, that issue still would come up.
But
Should
it's not a problem, Father, for them because they have their own research, they have their own
Yeah.
scientists, so they're developing vaccines that are of the same. For example, for the dengue vaccine, 1, 2, or 3 other companies, or even NIH of the United States is trying to develop one. So may kanya-kanya silang process. Each one of them will have their different pathway of how to develop the vaccine. And all of these vaccines will, of course, undergo clinical
Yeah.
testing.
But for example, when they are already in the Philippines, no, it would be very hard for pharmaceuticals here to copy it, knowing for a
If
fact
it's still
that
patented.
it is patented, something like that, and it is life-saving. And there is the controversy there, what is legal,
Yeah.
and what is something more
Ethical also.
ethical, for that matter. Okay.
Yes, and I think we will discuss that on another episode if Dr. Artes would like to. Kasi nga, Father, as you said, on one hand, you have the pharmaceutical companies
Yes.
who pay for the R&D. And hindi po mura lang yun. It takes a
Correct.
lot of
As I've said,
expense,
20 years
research.
dengue.
Yes, before you develop that drug or vaccine. And then on the other hand, you have patients who feel like it should be given to them at a very inexpensive price. So you have to balance the interests there. But we've come to the end of our show and would like to invite Dr. Sally to please invite or to give her last words. This camera, please. So for those of us watching the show.
Okay. I'd just like to say that vaccines actually save lives, and especially for mothers to have their children vaccinated against so many diseases, because this will prevent them from getting the disease, it will prevent them from suffering from the complications, and definitely it will provide a decreased incidence of all these vaccine preventable diseases in the Philippines, and will because the vaccine can also protect other people who have not been vaccinated. So, dear mothers, please bring your children to your pediatrician or to your local health centers for their vaccination.
Thank you very much, Dr. Sally, for those wise words. If you have any questions, please don't hesitate to consult your pediatrician, as what Dr. Sally has told us. And again, thank you for being our guest in this episode of Medical Dilemma. Tune in again next week for another episode right here on GNN.
Medical Dilemma